using liposomes is much more elegant, I would call it, because you're not interrupting anything. You're not messing with cytochrome P450 enzymes. You're not disturbing the gut or irritating the gut at all. You're just allowing these nutrients to get into the small intestine, get absorbed, go directly to the tissues, and then increase the amount that you're going to get in the tissues.
Welcome to the Fredrickson Health Show, highlighting expert practitioners from health, fitness, injury prevention, functional medicine, and integrative medicine. If you are into upgrading and optimizing your health, this podcast is for you. This podcast is for educational purposes only and not intended to be used as personalized medical advice. And now, here is your host, Dr. Robert Fredrickson.
Hey guys, welcome to another episode. We're excited to have Dr. Alan Miller, a nutrition researcher, expert with over 30 years of dietary supplement experience. Dr. Alan, thank you so much for coming on today.
You're welcome, and great seeing you.
For anyone listening, what is a liposome molecule and how does that work in the body?
Liposomes are submicroscopic spheres. They're tiny, so tiny you can't see them with a regular microscope. You can do some imaging with electron microscopy, transmission electron microscopy, or cryo-TEM can visualize these molecules. And when you visualize them with TEM, you can see that they are indeed submicroscopic, tiny little spheres. What's so great about that is that these spheres are made up of phospholipids, like the phospholipid bilayer that you see in your cell membranes. Very, very similar structure to what we've got in our cells, in our cell membranes, which enables these tiny molecules or bubbles to interact, attach to the cell membrane, and cause the cell membrane basically to fuse with these phospholipids, open up, and allow the nutrient or the botanical to then go through and into the cell. The great thing about this is, let's look at the molecules that are difficult to absorb. The hallmark that is curcumin, or curcumin, depending on the way you pronounce it. But from turmeric root, it's really poorly absorbed. And 30 years ago, researchers were just looking into the benefits of this molecule. And it's got great benefits. And at the time, it had great benefits in the lab. It had great benefits in really high dose that ended up causing gastrointestinal disturbances and symptoms. So everybody in the last 25, 30 years, every manufacturer, every ingredient supplier has been trying to figure out, okay, how do we improve this? The first step was a black pepper extract that does improve the absorption about 5x, right around there. But this black pepper molecule comes with a little bit of baggage. It interacts with cytochrome P450 enzymes in the liver. So it can make it so the liver is now not detoxifying substances the way it should. And then you can end up with higher levels of pharmaceuticals that you don't want, or just higher levels of toxins from inside the body and from exterior. And we don't want that. The black pepper extract, depending on how much you use, can be an irritant in the gut too, which is one of the theories of how it ends up getting things absorbed better. So using liposomes is much more elegant, I would call it, because you're not interrupting anything. You're not messing with cytochrome P450 enzymes. You're not disturbing the gut or irritating the gut at all. You're just allowing these nutrients to get into the small intestine, get absorbed, go directly to the tissues, and then increase the amount that you're going to get in the tissues. So it works for those things that are really poorly absorbed. And then we've also found it works for things that are pretty easily absorbed. Vitamin C, we've talked about. Vitamin C is very well absorbed. It's water soluble. It's not some strange molecule. However, vitamin C gets absorbed to a certain degree. So up to about 250 or so milligrams at a time dosing gets absorbed really well. Beyond that, that's where you've got issues. And that's where that unmetabolized and undigested and unabsorbed vitamin C ends up staying in the gut and attracting water and causing diarrhea. So that's one area where you've got an improvement in something that is a very simple nutrient. And then you've got things like I said, like curcumin, like resveratrol, also a really tricky little molecule to get enough into the body. So what we've found in clinical studies is that the liposomes both increase the amount of the substance that you're looking for and decrease the amount of any gastrointestinal issues from either not the substance not getting absorbed very well, or the substance is somewhat of an irritant. Some botanicals are. So it can decrease that. The opposite of that is also that these nutrients, because they are surrounded by phospholipids, phosphatidylcholine, phosphatidylserine, phosphatidylinositol, phosphatidylethanolamine, since they're surrounded, encased basically in these phospholipids, they don't get metabolized. They don't get damaged by stomach acid like some nutrients can. They also don't go through first pass metabolism into the liver, where the liver is going to attach a sulfur group or a sugar or something to it, and then you've got an inactive molecule. That's actually the issue with resveratrol. Resveratrol gets metabolized, goes to the liver, gets metabolized very quickly, and then you've got less of it going out to the tissues as unmetabolized resveratrol. So doing this, it protects that nutrient or that botanical, and also protects the gut.
So interesting. There's so much to unpack. I have so many questions because I've been in this industry not as long as you have, but long enough to hear all the different methodologies, theories, hypotheses about absorption, gut microbiota reactions, the black pepper dilemma, so many things. So when you're talking about a liposome in particular, are we trying to, and is there a case that, oral vitamins, still have a place? I know you said vitamin C up to 250 milligrams. I always thought it was 1,000. So that's interesting to say, think it's a little bit lower. I guess is there a threshold to that, to vitamin C? If you are having a bowel movement, of course you met your threshold, you've taken too much, or is there still a cellular uptake response or level that you can keep loading until you get to a certain saturation point? And that's where kind of the liposome kind of bypasses that?
Yeah, that's pretty much it. I mean, the mechanism for absorbing vitamin C, I wouldn't say it stops at 250 milligrams, but it slows down. It makes it so it's not as efficient after 250. Some people at 1,000 milligrams, they're having diarrhea. Other people, hey, guess what? We're all individuals. So I'm fond of saying, we all look different on the outside. Our bodies, our organs look different and act different on the inside as well. So we can't say, blanket, one size fits all, this is going to do this. When we get into that with medicine, we're in trouble.
Yeah.
But when we look at people's individuality and we understand people's issues potentially with different nutrients or botanicals, then we start understanding better, how we can help them. There are some issues like with vitamin C that we know there is a threshold. Same thing with magnesium. Magnesium gets absorbed pretty well, depending on the form of magnesium, but you are going to reach a threshold. And for some people, like a family member of mine, that threshold is about 250 to 300 milligrams of magnesium. After that, diarrhea. Other people can handle a much larger amount of magnesium at a time. But when you put that in a liposome form, you're going to get so much more of it absorbed that you have a much lesser chance of ending up with any gastrointestinal issues.
Yeah, that is so true with magnesium. And I always tell people to, spread it out throughout the day. Don't take it just all at once. Otherwise, you might have
Yeah.
you know, a release about release, or, for research shows you need to spread out the dosing. But again, it's
Mhm.
about intracellular absorption, like because magnesium, potassium, they're intracellular cations. So you want to make sure you're getting those minerals inside of the cell, and liposomal delivery makes it sound like that's going to happen more readily and effectively and more predictable.
Right. Yeah. We were just talking about what's in the gut and what's going on there. So when you get to the tissue, then it's also more efficient and more elegant in delivering that nutrient to the cell.
And so, magnesium is one of my big things that I'm passionate about and talking about. But I want to talk about glutathione today because I think that is a molecule that has been
Yeah.
talked about a lot for delivery, especially in the liposomal world. And then I know we used to think it doesn't get absorbed at all orally. And I'd love to hear your thoughts on that. And why is the liposomal delivery of glutathione very effective?
I've been in the same boat as you and looking at it through over the years. The early research on glutathione showed that it didn't get absorbed. And then later research on different forms of glutathione or different products showed it can get absorbed to a certain extent, but it's still poorly absorbed. And let's take a step back just really quick in case people don't understand exactly what glutathione is. Glutathione is what's called a tripeptide. So it's three amino acids. Glycine, glutamine, and cysteine. Those amino acids are bound together, and the first thing that happens when you take oral glutathione is it goes into your stomach, and your stomach acid acts on it, and stomach acid's very efficient at breaking apart those bonds. So great. Now you've got those three amino acids in your stomach, and then then they're going to go into the small intestine. And what we're doing with I think the mindset with some glutathione supplementation is, oh, it's okay. We've got the amino acids there. We've got the substrates, and we can trust that they're going to get reassembled in the liver. Not necessarily, and because those amino acids can be utilized elsewhere. It's not just that they're going to go to the liver and the liver's going to go, aha, we need to make glutathione and stick them back together, because you use those amino acids for making proteins and for gut health and for antioxidants. And so it's not necessarily going to work that way. When you put glutathione inside of liposomes, you get that, first of all, you get that protection, like I was saying, of the molecule. So it goes into the gut and into the stomach, and it's not going to get broken apart as readily as it would if it was just naked. So that's the first part, is you get that protection of that glutathione molecule. Then it goes into the small intestine, it gets absorbed, it goes where it needs to go, and it's the highest level intracellular antioxidant that there is. Besides everything else it does, and the fact that it works in the liver to help detoxify and such, it needs to be in all of our cells for its role as an antioxidant and for its role in the mitochondria as well.
So
So this is
interesting.
a great way to improve that absorption far over what you would get from a non-liposomal glutathione. And
Yes.
I sent you a paper that shows that.
Yeah, and we'll link that in the show notes for sure. And for glutathione, for
Cool.
anyone listening who's just maybe like, oh, because glutathione and green tea, and I know you guys have an amazing green tea and EGCG product, there's so many different benefits to these molecules. What are some things that stand out that, someone who might be deficient or low in glutathione could expect or benefit from?
One of those things that you may not notice. You may not notice that you are deficient, right? There are no red flags. There's no blood test. You run a CBC, you're not going to see anything. You're not going to see that you're deficient in glutathione. You can run a CBC and see that you're deficient in B12 or folate or iron, because there's big red flags on that CBC and what happens to the red blood cells. You don't see that with glutathione. So what people can notice after taking it is sometimes it's something that they weren't even aware of. They take it and they have more cellular energy because of it. Or because of that, then they're like, oh, I feel much more energetic during the day. I'm not so fatigued. So that can be one issue. Another issue, like I said, is glutathione works in the liver. It works to detoxify substances in the liver. And those substances can be molecules that we create, like hormones, and it can be xenobiotics that come in from the environment and from our food. So it helps to process those things and get them out of the body the way that it should. So people can then have, like I said, more energy, more feeling of just well-being, better sleep, better sex. There are so many different things that can happen that, like I said, you may not have even thought, oh, well, this is because I'm deficient in glutathione. Yeah.
And we and you have talked previously about this, but could you share, I think this is so interesting, the role that glutathione can play on sleep. And I believe you wrote an article or press review over this topic. And so if you could just briefly kind of go over that mechanism, I think it's so interesting.
Yeah, it's one that really isn't widely known, but glutathione, one of the things that glutathione does is as you're sleeping, it basically helps the brain to clear out the clutter. Because one of the things that we're doing as we're sleeping is cataloging stuff, cataloging memories, cataloging things that we experience throughout the day. And the other part of it is to then metabolically clean up. So that's one of the areas that glutathione is working in. We did a sleep study with a product that contains a little bit of melatonin, some GABA, and some glutathione. And even though it was a small study done right in the midst of COVID, so it was difficult to get people involved in it. And those people that were involved in it were pretty stressed about other stuff in their life. But we still got significant results. And, like I said, it helps people have a better feeling of well-being. In this case, it decreased the amount of time that it took for people to get to sleep. It increased the amount of time that they stayed asleep. That's pretty much why you're taking melatonin or any kind of sleep formula, is those things. You want to get to sleep quicker, you want to stay asleep longer, and that's what we found.
That's awesome. And I love that product. That's one of my favorite formulas. I've tried melatonin so many times. And of course, after the pandemic, melatonin is definitely a hot topic for, down regulating the NLRP3 inflammasome complex and, kind of putting a damper on the cytokine storm. So I was taking high dose melatonin, but I felt like a zombie in the morning. Like I just felt like so much melatonin was still in my system. And I tell everyone this, like the liposomal delivery, it gets in your system fastly absorbed, but also seems to get out of your system at an appropriate time. So you can wake up and not feel groggy, feel like you still have a ton of melatonin still in your system. So that's kind of been a game changer for me.
That is what we've seen. Oh, that's great. Good. I don't take it just because I'm one of those really lucky people that I rarely have an issue getting asleep or staying asleep.
Lucky. I envy you.
Yeah.
So one thing I wanted to ask, and this has always been a thought before, is, how does liposomes work for people who have, malabsorption issues? This could be ulcerative colitis, Crohn's colitis, or even advanced intestinal permeability. Maybe it's even celiac disease, gluten sensitivity. How do liposomes work in a inflamed environment like that?
Really good question. The brutally honest answer is we don't have enough data to know for absolute, just because those are patient populations that are difficult to study. And so I haven't seen a whole lot of interest and a whole lot of research in those areas. What we do know is that liposomes get absorbed quicker and more efficiently across the board. So in somebody who has an inflamed gut, part of the issue with an inflamed gut is that you've got too many things getting absorbed. So you've got, antigens, food antigens and environmental antigens that are cruising across the gut, and then you've got issues with that. The other issue is, fat-soluble nutrients, fat-soluble vitamins. If you're celiac, you have celiac disease, you tend to be deficient in things like vitamin D. And it makes it more difficult then to supplement and get people back up with their vitamin D. In fact, that's really one of the hallmarks of celiac that a lot of practitioners have told me, but a lot of practitioners also haven't recognized, and that is when you give somebody vitamin D, you do a vitamin D blood test and they're low, and you start supplementing and nothing happens. And their blood level just stays the same throughout. Like, wait a minute, we've got absorption issues here. And I've seen that in a study that we did a couple of years ago on vitamin D. We looked at vitamin D, non-liposomal vitamin D, and then liposomal vitamin D. And not only did we have a significant increase in blood levels of vitamin D, or 25-hydroxyvitamin D, in the individuals that took the liposomal, we also had an improvement in those people who, when they were taking the non-liposomal, flatlined, and when they took the liposomal, it improved. That was telling me, okay, that person has, and we only had a couple people in this study that flatlined like that, but that was telling me those people have absorption issues right off the bat. They were low, you give them stuff, nothing happens. And then you give them liposomal and it improves.
So someone who has increased absorption, from intestinal permeability or maybe some advanced inflammatory bowel issue, would you start low and slow with a liposomal because you're going to have the increased absorption, or is that nothing to be concerned about since it's going to have?
No, I think that's a really good tack to take with anything, with somebody with a chronic inflammatory problem in the gut, because you don't know absolutely how they're going to respond to it. So yeah, low and slow, I think is the best way to do it. Start slow, make sure that everything's going to be good. They're not going to have a problem or react to it in some way.
Gotcha. And so just to kind of, I guess, play devil's advocate, because I've been on two different sides in this field, and this is why it's always interesting and great to have these conversations. Is there, with the liposomal delivery, it's kind of bypassing the gut interaction, or is it? And is there any downsides to taking a liposome versus oral for missing that gut microbiota interaction?
Really good question. I actually have a little button that says the devil has enough advocates. But in this case, no, you're right. There are certain things that you really don't want to deliver liposomally. It's few and far between, but those things that you want to deliver, like probiotics, you probably don't want to do probiotics directly, in a liposome. You want those to interact with the gut. You want them to, in some cases, you want them to improve the amount of those probiotics that you're delivering, or you're trying to improve the gut environment so that other beneficial bacteria will want to be there, and that sort of thing. So in that case, yeah, there are a few things that you want to get directly to the gut. You don't want it to get absorbed so quickly, go through the lymphatics, go to the rest of the body. One thing though, that there's some theory, or there's some thinking about curcumin that, you want it to, you don't want it to get absorbed really well because you want more of it to be cruising through the gut and actually interacting with those cells in the gut. And I had a really interesting conversation on a podcast with one of the premier researchers in curcumin research, and basically what he was saying was that's hogwash, and what you really want to do is make sure that you have an absorption capacity in that molecule, however you're doing it, so that you get enough of it in the gut, or enough of it in the blood, because then it goes through the blood and it goes to those intestinal cells via the bloodstream, not via the lumen of the gut. And he says that's where you're going to get your best bang for your buck and your best anti-inflammatory activity, specifically with curcumin.
Yeah, so that was actually what I was thinking as well. As you know, I had been trained and had this thought process that we needed curcumin. It was been around in India for forever, and they have some of the lowest incidence of gastric cancer and ulcers, and we kind of coined that to the whole root, not just curcumin. And so there's a whole kind of theory behind that. And anyways, but that makes sense. Yeah, if you're getting better absorption to the blood, you're going to have the effect that you desire. Um, and then in probiotics, yeah, you want that gut microbiota reaction. So you wouldn't deliver something like that in a
Yeah.
liposome.
Yep.
So with fat soluble nutrients and using it also, so when you're delivering a liposome, do you have to only deliver a single nutrient, or can you combine nutrients? Like, would there be something like an immune support package with vitamin C, vitamin D, zinc, you know, NAC? Is that feasible, or is that how would that even be, possible?
No, it's not impossible. It absolutely works. You can put a number of nutrients, botanicals inside that liposome. So it doesn't have to be just a single nutrient or a single botanical. We participated in a study, company called Solar Ray.
Okay.
They've got a multi that we made for them, the liposomal multi, and they sponsored a study where they looked at different blood levels of different nutrients and found that we had improved amounts of certain nutrients, of iron, of calcium, magnesium, and some other things from taking the liposomal multi. The other thing that we found on that was we had some researchers do the TEM, the transmission electron microscopy, and you can see the lipid bilayer, and you can see basically what looks like a big rock, big space rock inside of that. That's the nutrients, plural.
Interesting. So
Pretty
with
cool.
all the research that you guys have done on liposomes, I know there's a lot of different imitators out there. I know there's a lot of companies who have liposomes. I've even heard of, like, you can make your own liposomes at home. Um,
Yep.
is that feasible? Is that
Seen that.
possible?
Well,
What constitutes a good liposome versus maybe an inferior one?
yeah, my first question is, do you really want to do that at home? You really want to go through that? Because it's not easy. And it's, it can be pretty messy if you wanted to try to do that at home. Some people really want to do that, that's fine. I would say let's leave it to the professionals, only because we know what works. We know the process of creating the liposomes. We know what both works, what's going to make them stable, what's not going to damage them in the process. So you were talking about different types of products and imitators and things like that. There are some other products that use phosphatidylcholine that just blend it with whatever substance they're trying to improve the absorption of. That actually does help to a certain degree. It does show that it improves absorption, but it's not a liposome. There are other folks that use liposome. They don't use liposome technology. They use liposome research to try to back up what they're doing, and they're not actually making liposomes. They're making things like micelles. So it's not the same technology. It's not the same output when you're done with the process. So yeah, it really takes somebody who's been working on this, that really knows what they're doing. The founder of the company I work for figured out how to do liposomes very elegantly without heat or pressure or solvents, which are the three things that can damage those liposomes. It can help you create them, but if you do it wrong, it can screw them up too. He figured out how to do that as a PhD student. and kind
Wow.
of put that in his pocket and said, "This is interesting. I might need this someday." And then ended up starting, working for another company and licensing his technology, and then coming over and starting this company. And and then refining that technology along the way, so that we know what we're doing.
Right.
And there's the proof of it, of course, is being able to do the transmission electron microscopy and see visually that yes, these are liposomes. These are tiny microspheres, and you can also do something called dynamic light scattering. Dynamic light scattering, or DLS, shows you the size of the particles and the distribution in size of the particles. So if you're doing it right, you've got small particles, not too small. You don't want them in the nano range. If you're in the nano range, first of all, FDA doesn't like that. And there are some other things, some other possibilities when you're in that nano range, that you're increasing the absorption so much that there could be issues. So you want to be above the nano range, but you want them to be small, and you also want them to be within a very finite range of size. So you don't want them to just be all over the place. You want to have your processes so that you're creating something that is the right size and the right size distribution as well. So DLS just shows us that, yeah, we're doing it right.
That's awesome. So it seems like there's a lot that goes into this, and solvents like alcohol. I know that can be a solvent that some other companies use, and that could potentially, you know, have some degradation of that liposomal complex maybe. And then one of your papers
Sure.
that you sent me, there was like a range. You know it better than I do. It was like 45 to 500. Was that correct? Or something like that. I can't remember what
Of
I
the size,
looked at earlier, but it was a like for the size of the molecule, and that was kind of like that range
yeah,
you're speaking to, right above the nano, with that specific,
right. You want it to be above 100 nanometers. You want to be above 100 up to about 500.
Gotcha. Okay, thank you for sharing that.
And actually, I'm glad you asked that, because there are people that say, well, the smaller the better. You need to have these to be nanoparticles. And my response to that is, cool, show me your research on that. And then you get crickets. So that's the other piece of it, is you need to make sure, if you're going to make liposomal nutrients, you need to make sure that you're taking some of that money you're making and putting it back into the company and back into research, so that you can prove both the efficacy and safety of your product.
Correct, correct, and yeah, appreciate all the hard work that you guys do and all the research that you've done. And what new research is on the horizon? Is there any research that you'd love to see done in the future? Any possibilities that we could expect?
I don't want to tip my hand completely here about what we're working on, but there are some, let's say, energetic nutrients,
Okay,
some anti-aging nutrients that, again, get sort of a bad rap, because people say, well, that stuff doesn't get absorbed. And we're showing it does. And we're showing that it gets absorbed better with liposomes. I'll leave it at that, because we're in the midst of that study, and I can't divulge a whole lot about the results until we're completely done.
gotcha. Well, I look forward to seeing the results when they are completed. Um,
Yeah.
well, this has been a fantastic time learning more about liposomal technology with you. Dr. Allen, where can people find you? Where can they learn more about your work? Where can they learn more about liposomal technology?
One of the places you can go to learn more about liposomal technology is cellgate.com.
Okay,
It's pronounced Cellgate because that's basically what you're doing here. Is you're taking that lipid bilayer in the cell, you're fusing your nutrients to it, and it's opening up like a gate and allowing the nutrients to come in. When you read it, it's like a personalized license plate, because it's CELLG, the number 8.com.
gotcha. Very cool. And they can
Right.
find some
Cell
research.
G8.
Cell G8.
You can find all the research that we've been involved in at that website.
Awesome. And then a few fun questions I like to ask everyone at the end.
Yeah.
If you could take a botanical herb supplement what have you. You get to pick one, and you take this on a deserted island. What would you take with you, and why?
Curcumin.
Curcumin. Okay.
Curcumin. Actually, I might say I'd take that, and I would also take some turmeric root. That's where it comes from. But I would use it then in food as well as for my medicine.
I love it. I love it. If you could put one phrase on a billboard that everyone can see, it could be health related, motivational, inspirational. What would you want people to read when they drove past it?
My first thought is something I probably shouldn't say. Um, maybe I can tone it down a little bit. Don't be an idiot would be one thing. And the other is listen to your body,
Yes.
because so often we don't, or something's going on. We've got some nagging little thing, and it gets set aside because we got lives to live. We got things going on, and then sometimes, not all the time, but sometimes those nagging little things turn into something that bashes you in the head and says you have to pay attention to me now.
Yeah. And if we're thinking about it in the context of liposomes, and you have to pay attention to me, what would you say to someone who's still kind of skeptical about liposomal products? They might be, slightly more expensive than others. What would you say to someone who's kind of on the fence about trying a new liposome, or maybe a doctor recommending a liposomal product to a patient? What would you say kind of to that individual?
Trust the science.
Trust the
Really
science.
trust the science. Liposomes aren't anything new. Liposomal technology has been around since the 1960s. And it was so promising early on that, of course, pharmaceutical companies jumped in and said, how can we use this? How can we make it so that we can get more of these nutrients to the tissues, or in their case, more of these drugs to the tissues? So a lot of the early research was on cancer drugs, and it's still ongoing, trying to get those drugs to specific tissues in really high levels. And the technology as far as nutrients and such has been around for 10 years or so. But along with that has come research as well. So we like to make sure that we're trusting the science, that we're trusting that that these things are being looked at and they actually work. And like you said, sometimes the price is a little bit higher for them, but when you think about it, you don't have to take as much to get the blood levels where they need to be. So you don't have to take 1,000 to 5,000 milligrams of vitamin C when you can take much lower levels. You can take up to about 1,000 if you want, and you're going to get much higher blood levels. So the equivalency on that can be staggering. You can take unmetabolized or unformulated resveratrol and then take liposomal resveratrol and get levels that are 10 times higher.
Wow.
So you're not wasting your money. You're not throwing money away. You're not throwing money down the toilet in some cases. You're actually getting something that gets absorbed, gets in the body, and works.
Awesome. And I know there can't be a set range, or, uh, there's no way to quantify this probably from molecule to molecule, but on average, like when you're looking at a liposomal product, is it 5x times better absorption on average? It's like, because you look at it, you got 2 milligrams of melatonin. Is that 5x? Is that comparable to a 10 milligram product? And if someone's sensitive, maybe they should do low and slow, like we talked about earlier.
No, that's actually a great way to do that sleep product. Start slow, see what affects you, see how it does, see if you need to use more. But as a blanket, there isn't really a blanket 10x better absorption, because we're talking about different substances, different nutrients. And something like vitamin C, you can get about a 3x. The research that we did showed you get a 3.5 times more into the blood than you do with non-formulated vitamin C. With curcumin, it's up in the 20s or up to 40x, because it's so poorly absorbed when it's unformulated. So it really depends on the molecule. And like I said, our vitamin D, We had some individual variants, in different patients. Like I said, we had one patient that was just flatline and then improved with the liposomal. So it really depends. Depends on the molecule, depends on the patient, but you can get anywhere between 3x and 40x.
Wow. So cool. And love the advances that we're having with nutrient delivery. And so, again, thank you so much for coming on today. Would love to have this chat again. I'm sure that we're going to get a lot of questions over different nutrients. Can this be delivered into the liposome? What about this one? So much to unpack later. And I look forward to connecting with you later on this year. So
Sounds good. Love to.
awesome, Doc. Well, have a great day, and we'll talk to you soon. Thanks again, guys.
All right.
Thanks
Doc.
for listening to the Fredrickson Health Show. This podcast is for educational purposes only and not intended to be used as personalized medical advice. Be sure to subscribe to this podcast so you don't miss a single episode. While you're at it, leave us a rating and review. Follow us on social media and subscribe to our email newsletter for more information.